Today, Jasmine and I will be presenting on teledentistry's role in preventing geriatric oral health decline during COVID-19. The current coronavirus pandemic has brought about concerns regarding access to oral health care for patients in populations that are considered to be high risk for contracting COVID-19. The focus of this presentation is going to be on the geriatric population, which is defined as adults over the age of 60 years old and their specific oral health care needs. Strategies in teledentistry as a way to improve access for this population will be examined, and the role of the registered dental hygienist in alternative practice, which we'll refer to as the RDHAP, will also be examined as a suitable role to implement these strategies. The RDHAP role and strategies in teledentistry may be the solution to increasing dental care access to geriatric patients during the coronavirus pandemic. Let's begin with a discussion of our target population. The geriatric population is more prone to tooth loss due to dental caries or periodontal disease, more likely to suffer from xerostomia, and are at a higher risk for developing oral cancer than other age groups. Studies have shown that with this age, oral health becomes an increasingly significant factor affecting overall quality of life. Oral health disparities within this group that affect their qualities of life are all preventable with the implementation of routine preventative care. Studies have also shown that barriers to access of routine preventive oral health care also increases with age. A cross-sectional pilot study concluded that the decline of oral health status in geriatric population is a result of lack of access to care, not a result of aging itself. Preventative dental care and education, which are both routinely provided by registered dental hygienists, are pivotal in preventing this population's decline in oral health related to quality of life. The coronavirus pandemic has introduced new barriers to care for the geriatric population. A secondary research article investigated the effects of the pandemic on the geriatric population. This article found that since the pandemic began, geriatric patients have avoided seeking treatment of oral diseases for multiple reasons. These reasons include fear of contracting coronavirus, cost of dental care, as well as perceived and actual barriers to access. Geriatric patients understand that if they were to contract coronavirus, the progression of the virus could be more aggressive, and any comorbidities that the elderly have can further complications to the pathogenesis of the virus. This understanding has made the geriatric patient population as a whole avoid seeking dental care. In addition to barriers discussed previously, the geriatric population now has new concerns unique to them in navigating oral health care services with respect to communication. This includes a major challenge with communicating because of the use of masks. Geriatric patients with hearing loss will have difficulty hearing others with face masks on. Additionally, these patients may rely on the ability to read lips, which is now hindered by mask use. As masks are likely to be used for the foreseeable future, a solution to this communication issue is necessary.
That same secondary research article proposes teledentistry as a method to overcome these barriers to care for this population. Two of the proposed methods include phone or video consultations and apps on smartphones or devices. These two methods are both currently limited in their use. Phone and video consultations do not allow for clinical assessment and may be better suited for triage or follow-up appointments. Apps on smartphones or devices where patients can report their symptoms to be examined by a specialist can be useful, but are limited by the fact that geriatric patients may have trouble navigating the electronics needed for it, and a limited number of specialists utilize this type of technology. Additionally, teledentistry must also follow the same HIPAA restrictions that traditional dentistry follows. Despite these limitations, having these strategies in place minimizes both patient and clinician exposure and thus reduces their risk of contracting COVID-19. If the patient requires in-office treatment, these consultations provide the clinician an opportunity to reduce the patient's anxiety by explaining the steps taken to minimize this patient's infection risk. Video consultations also provide a means to overcome the previously discussed communication barriers that occur with mask usage. We keep referencing RDHAPs, but for anyone who's not familiar with the term, RDHAPs are registered dental hygienists that are licensed to provide dental hygiene treatment and services in settings outside of the traditional dental office to those with limited access to care. RDHAPs are able to provide preventive services in settings such as schools, skilled nursing facilities, assisted living facilities, and private homes. The limitation to their practice is that RDHAPs may only provide services that have previously been prescribed by a licensed dentist after physical examination of the patient. This can be resolved if more dentists also begin participating in teledentistry. RDHAPs already implement various forms of teledentistry in their mobile dentistry practices, and given that the coronavirus pandemic has led to a recent surge in secure, HIPAA-compliant teledentistry platforms available for use, RDHAPs are presented an opportunity to expand their practices to reach more patients. Once any etiotropic, surgical, or restorative phases of treatment have been completed, these platforms allow the RDHAP to independently provide maintenance-based therapy and continue to keep the dentist informed on the status of the patient with more ease. Assessments, new radiographs, treatment notes, and any other patient records can be communicated back to the dentist and can be stored in a cloud-based system. To recap a bit before we wrap up, the state of a geriatric patient's oral health greatly influences their reported quality of life. The majority of disparities seen in this population are believed to be preventable with proper patient education. Thus, a high quality of life among geriatric patients and the reduction of these identified disparities can both be achieved through routine preventive dentistry. The current coronavirus pandemic poses new challenges for access to care in the geriatric population. A viable strategy that we present to overcome these barriers and increase access to care for this population is teledentistry. Teledentistry can be applied to the profession of dental hygiene through the role of the RDHAP. Teledentistry allows the RDHAP and dentist to work cohesively and provide the geriatric population with patient-centered care. Thus, the RDHAP can help maintain the geriatric population's oral health and improve their overall quality of life during the coronavirus pandemic and beyond.